Great. Hey, everybody. I'm Imran Yousaf. I'm an attending physician here in an outpatient clinic in Southwest Virginia. And my presentation today is on Baricitinib, a potential treatment for patients with a combination of RA, SLE, and alopecia areata. As you guys know, there is a condition that is somewhat known as lupus, which is not like an official disease name, but it kind of nicely sort of mixes and this combination of patients who've got RA, who've got symptoms of lupus, like the erosive changes, the synovitis, the classic malar rash, and also some patients who have alopecia areata. And so we essentially saw a patient in clinic who presented with hand tenderness for approximately like 1 month. And he also had patchy hair loss for a few months. And so objectively, as you can see here on exam, he had stable vitals. He was afebrile. His right second MCP did show the classic synovitis changes or swelling around the joint capsule and tenderness to palpation. He did have intact, active, and passive range of motion. Now, he didn't have the classic erythema and skin rash that you would ordinarily see in patients who've got lupus, but he did have severe alopecia areata. And you can see here in the image on the top, you can see classic pictures of that. This is not our patient. I just took images from UpToDate to just sort of demonstrate how it would typically appear. But he had something quite similar to that. The X-ray above also shows some of the classic erosive changes that you would see in patients who've got RA and lupus. Anyway, so moving forward, he had some labs that were drawn. He had a positive ANA, which indicated some autoimmune condition. His anti-double-stranded DNA, which is typically quite sensitive for SLE, was low positive. And he also had a positive RF factor, which if you put them all together with the hand ultrasound that he also had showing erosive changes with diffuse inflammation, there was a concern that he had this sort of mixture of rheumatoid arthritis and lupus with alopecia. And so hence, we suspected that he probably had this lupus-like condition. So typically in these cases, you would start the patient on medicines like hydroxychloroquine, which we did for about, for quite some time. He had 200 milligrams daily. At his first follow-up visit, as you can see here in the chart, he had no change in his synovitis and no change in his alopecia. So then, of course, we shifted to Plan B, and we put him on Baricitinib, which is a very strong JAK1/2 inhibitor. And we put him on a very low dose of 2 milligrams daily. And then, of course, after several weeks of that, at his second follow-up, he had improved synovitis and hair growth. And so this is quite a unique thing to observe, simply because of the fact that lupus is incredibly rare. It doesn't really have any validated diagnostic or classification criteria. And so, while some treatment options have been discussed or trialed with patients who've got lupus, the use of JAK inhibitors have rarely been reported. And so it's also not officially approved for treating SLE. However, there was a recent double-blind trial that did show that 4 milligrams of baricitinib was associated with significant improvement of SLE symptoms when compared to 2 milligrams of baricitinib. And so our patient, of course, responded very well to this lower dose of baricitinib. And we thought that to be quite interesting and simply wanted to share that since there's very limited data showing the utility of this drug in patients who've got this kind of condition. As you can see here in the bottom left hand of the poster, there's a small schematic that kind of shows the mechanism of action for baricitinib. You can see here that they inhibit JAK proteins and thus inhibits phosphorylation of proteins in the nucleus. And so the end result of that is that the inflammatory processes happening in the body kind of shut down temporarily, thus allowing the patient to benefit from its improvement in the symptoms. So I think in conclusion, I would say that lupus is a rare condition characterized by symptoms of RA, SLE overlap. Baricitinib is a JAK1/2 inhibitor, which is approved for the treatment of RA and alopecia areata, but not officially approved for SLE. And so we trialed this drug in a patient who had a combination of all three of these conditions, and he did very, very well with it. And thus, this is, I think, a promising sign to just note that this drug could be a potential treatment for patients who've got lupus.